Hey, what is up, Warrior? This is actually one of the paid trainings inside the Private Wheel Warriors community, but I know how many people out there are struggling with testosterone deficiency, and a lot don't even know it. People aren't even aware that that's what's happening. Okay, so I know how much of a difference this can make in your life if this is something that you're struggling with. So this is one that I wanted to give away for free to try and help as many people as possible, because let's be honest, having low testosterone is going to lead to a pretty low quality of life, and that's not what we want. But if you'd like more content like this, feel free to join Wheel Warriors. The link is in the description below. With that being said, please enjoy. Hello Warrior, welcome to the testosterone module. So what we're going to cover in this is deficiency symptoms. So you know when you actually are experiencing a testosterone deficiency, what that will feel like, what that will look like, and how that will present. Then we're going to talk about recommended blood tests so you can actually get this properly diagnosed and get the help that you need. We'll talk about the natural approach, including behavior, lifestyle, and supplements. And then we'll talk about testosterone replacement therapy, which is a little bit of a controversial topic sometimes, but when used correctly, it is incredible. I've seen it change people's lives. So this is obviously more applicable for the guys, but ladies, there's some great info in here that applies to you as well. So what sort of symptoms would you expect from a deficiency? A reduced sex drive. A significant decrease in libido is one of the most noticeable signs of low testosterone. So if you have a partner, or even if you're dating and you just don't feel like having sex, you don't feel that sexual attraction, that is a symptom of a testosterone deficiency. Doesn't mean that you have a deficiency, it's just one of the symptoms. Erectile dysfunction. Difficulty in achieving or maintaining an erection can be associated with low testosterone levels. Obviously this changes with disability a little bit. Okay, like anything affecting the spinal cord's going to affect erections anyway. You may only be able to get reflex erections already, but a good measure of this that I use is whether you wake up with morning wood or not, whether you have an erection when you wake up in the morning. If you do, then you're probably alright. If you don't, that is another symptom of testosterone deficiency. Fatigue and lack of energy. Experiencing extreme tiredness and a noticeable drop in energy levels, even when getting enough sleep, can be a sign. So this is another one where disability is going to affect it. Obviously, living with a disability means that you're probably fatigued and have a lack of energy anyway. So you may just be extremely tired. You may have a drop in energy levels. If you were previously able-bodied and sustained an injury or attained a disability essentially, then there is going to be a significant difference in your energy levels and your fatigue just based on that. But it is still worthwhile getting checked out if you are experiencing fatigue and a lack of energy. Reduced muscle mass. Testosterone plays a role in building muscle mass, so a decrease might lead to noticeable muscle loss. On the flip side to this, it may be very hard to gain muscle. Okay, if you're putting the work in the gym, if you're sleeping well every night, recovering properly, if your nutrition is on point, and you're still not dropping weight or not building muscle, then that could point to a testosterone deficiency. Increased body fat. An increase in body fat, particularly around the abdomen, might occur. So testosterone obviously helps with your metabolism, how your body mobilizes fat, the energy that you have to put into exercise, all that sort of thing. And an imbalance in testosterone can cause you to gain body fat or have a really hard time losing it. So again, if you've been putting the work in the gym, eating properly, sleeping properly, and you're not dropping weight, you're not dropping fat, worthwhile getting checked out for. Mood changes. Low testosterone can lead to mood swings, irritability, depression, or a lack of focus. This one was the biggest for me. I was super irritable, felt depressed, couldn't really focus on much. Mood swings not so much, I just consistently felt, sad, angry, I guess. And
when I got my testosterone sorted out, this was the biggest change for me, was the mentality and, you know, your attitude waking up every day. It's changed so much. But if you are experiencing these, then definitely worth getting checked out. Decreased bone mass. Testosterone helps in maintaining bone density, so lower levels might lead to thinner, weaker bones. This is super important for anyone with a disability, you know, especially if you have like a spinal cord injury or, you know, something that actually prevents you from getting up and walking about. Low testosterone can lead to weaker bones. So if you have a fall, you know, if you crash into something, you're more at risk for fractures, osteoporosis, all that horribly fun stuff that we have to look forward to. Testosterone, if you are deficient, is going to lead to a higher risk of that essentially. Hair loss. Testosterone plays a role in hair production, so low levels can lead to thinning or loss of body and facial hair. This is different for everyone. Everyone's genetics around this are different, but it's not a primary indicator of a deficiency, but it is one. Sleep disturbances. This includes trouble sleeping or sleep apnea. So if you're sleeping, getting your 7, 8, 9 hours, and you're still waking up feeling like shit in the morning, then it's definitely worth getting checked out. Decreased semen volume. Testosterone plays a role in semen production, and reduced levels can lead to a decrease in its volume. So this one sort of speaks for itself. You know how to figure that out. Okay, so what kind of blood tests do you need to actually figure out a deficiency, and also just to get a general idea of your health moving forward? So total testosterone measures the overall level of testosterone in the blood, including both free and bound testosterone. So this is the total amount available in your body. Some of your testosterone is going to be bound. So free testosterone specifically measures the testosterone that is not bound to proteins in the blood and is available for use by the body. So what this means is you can have a high level of total testosterone, or like a normal level of total testosterone, but if you have a low level free testosterone, you're still going to experience the symptoms of low testosterone. Free testosterone is what actually helps with the mentality, the sex drive, the muscle gain, drop in body fat. Free testosterone is the important one. So you can test normal for total testosterone and still experience all the symptoms. Sex hormone binding globulin, SHBG. This protein binds to sex hormones, including testosterone. Knowing SHBG levels can help in understanding how much free testosterone is available. So SHGB is a protein that binds to your testosterone for various reasons and essentially stops it from being used by your body in those muscle building processes, in sex drive, all that sort of thing. SHGB can be elevated in multiple different conditions. It's messed up by diabetes. Ketogenic diets can elevate it. There's a lot of things that can play around with this. So if you get a blood test and there's a big difference between your total testosterone and free testosterone, there's a fair chance that your SHBG is going to be high. There are multiple things you can do to address that, which we'll talk about at another time. Luteinizing hormone, LH. LH stimulates testosterone production. Abnormal levels can indicate issues with the pituitary gland or testes. So LH is the signaling hormone that tells your testicles, hey, make testosterone. If this is low, that means that there's something up with the signaling. Your brain's not doing its job properly. Your brain's not telling your balls, hey, go and make testosterone. Follicle stimulating hormone, FSH. Along with LH, FSH is important for sexual function and can provide insights into testicular health. So very similar to LH, essentially. If this is low, it's an indicator that your body is not signaling correctly to your testicles. Estradiol, a form of estrogen, the measurement of which can be important, as high levels can affect testosterone levels and action. So a lot of people demonize estrogen, especially in men, but it's a little bit unjust because we do need estrogen. Estrogen helps with our bones, it helps with our sex drive, it helps gain muscle, it helps with our cardio health. it's neuroprotective. Estrogen is not evil, okay? I just want to make that point quite clear, because a lot of people have a habit of trying to crush it into the ground, especially men, because they think it's a female hormone. They think, okay, less estrogen is better. It's absolutely not. Testosterone needs estrogen to do its job properly in your body. Crushing your estrogen will be terrible. On the flip side of that, higher estrogen is something that we want to avoid as well, because it can lead to mood swings. It can lead to actually growing breasts if you're running it high enough. Can lead to acne, can lead to water retention, high blood pressure, that sort of thing. So we don't want it too high, we don't want it too low. Prolactin. Elevated prolactin levels can suppress testosterone production. So yeah, this is another one that you want to get checked out just to get a bit of a baseline, see where it's at, make sure everything's in the right place as it should be. Complete blood count. This test can give a general picture of overall health and can detect a range of disorders, including anemia and infection. So what happens a lot of the time when people get pressure wounds, especially if they're bad, your body will sort of burn through your red blood cells, trying to bring oxygen to those pressure sores, essentially. And so what happens is your red blood cell count can drop off, becoming anemic. I know a few people that this has happened to now. And some people are just anemic anyway. But complete blood count, this is an important one to get, because if you do go down the road of testosterone replacement therapy, you're going to want to know your red blood cell count, because if it gets too high, you can be at risk for blood clots. So it's important to know where it is now, and if you do end up on testosterone replacement therapy, understanding how much it's actually elevating, so you can keep an eye on your risk for clots, essentially. Lipid profile, to assess cholesterol levels, which can be important for hormone production. Also super important for heart health. Okay, the main ones that they're going to be looking at is cholesterol, triglycerides, HDL, and LDL. These are super important to keep in check for heart health, to sort of stop your arteries getting caked on the inside. They can get caked up with plaque buildups, and keeping your lipids in range is a good way, well, one of the main ways to manage that. Testosterone, if taken too high, can impact your cholesterol, your lipid profile, so it's important to understand where it is now, what your baseline is. You could also be predisposed to it through genetics, having messed up lipid profiles. So it's important to understand. Liver function tests. Since testosterone can affect liver function and vice versa, these tests can be relevant. So injectable testosterone generally does not affect the liver. There are some oral preparations that we'll discuss shortly that do. So liver function tests, it's always good to know how your liver's going anyway, but if your doctor won't get them for whatever reason, then they're probably not the most important at this point. Kidney function tests. Kidney health can impact and be impacted by hormone levels. Kidneys are super important. You probably know this. You've probably had issues with UTIs, maybe kidney infections, kidney stones, whatever. But for pretty much everyone living with a physical disability, kidneys are at a greater risk. So it's super important to look after them. So the main one that we'll probably be looking at is eGFR, which is estimated glomerular filtration rate. So that's just your kidney's ability to actually take toxins out of your bloodstream and push them into your pee, basically, so your body can get rid of them. That's going to be the main one. But try and get a full kidney function profile, blood profile, if you can. So you've done the blood tests, you've assessed yourself for the symptoms, and you have a testosterone deficiency. What's next? Next thing is the natural approach, and that covers three things: behaviors and habits, medications, and natural supplements. So behaviors and habits. A poor diet. A diet lacking in essential nutrients, particularly those that support hormone production, can contribute to low testosterone. So if you're eating like shit, your body is going to work like shit, essentially. So the first thing that you'll want to do is dial in your diet. If you haven't already, go check out Pillar 2, the nutrition module, and that will help you dial everything in, okay? Lack of exercise. Regular physical activity helps maintain healthy testosterone levels. Sedentary lifestyles can negatively impact these levels. So, as a wheelchair user, we are typically more sedentary. So, this can be a hard one. But the more you can get out and exercise, the better your testosterone levels are going to be, essentially. Excessive alcohol consumption. Chronic alcohol abuse can lead to lowered testosterone and increased estrogen levels. This is absolutely true, and this is a pretty big contributor. A lot of guys that I talk to who have been struggling with low testosterone are also pretty heavy drinkers, and a lot of the time as soon as they give that up, their testosterone comes back up, estrogen drops down, and they just start feeling better straight away. So if you are drinking, if you're a heavy drinker, cut it out. If you're having 1 or 2 beers on the weekend with your friends, probably not an issue, but if you're having 1 or 2 beers or more every night, then that's going to be causing you some problems. Smoking. Tobacco use can negatively affect testosterone levels. There's mixed reports on this. Some studies say that tobacco increases your testosterone, some say it reduces it negatively. So I'd err on the side of caution and probably don't smoke cigarettes because, let's be honest, they're shit for you in 1,000 other ways anyway. High stress levels. Chronic stress leads to high cortisol levels, which can inhibit testosterone production. So if you're someone that's super stressed out, you don't know how to chill, you don't know how to relax, you don't know how to manage the day-to-day stresses of life, then getting some coping skills around that, whether it's meditation, whether that's, professional therapy, whatever it is that you need to do to chill out and learn how to manage your stress, or just reduce the stress in your life. If someone's giving you the shits, then just try and get rid of it. That's the easiest way. But this will lead to low testosterone production. Inadequate sleep. Poor sleep patterns and lack of restful sleep can reduce testosterone levels. Very true. A poor night's sleep will drop your testosterone by literally like 40%, I think, somewhere around that, according to most studies. So you imagine if you have chronically terrible sleep, your testosterone is probably around half of what it actually could be if you just slept well. So, covered sleep in the previous module, so make sure you watch that, get your sleep dialed in. Obesity. Excess body fat, especially abdominal fat, can convert testosterone into estrogen, lowering its overall level. So the fat cells in your body are really good at converting testosterone into estrogen. And so basically your testosterone's lower, your estrogen's higher. And so what happens? You end up gaining more fat. And so more testosterone is converted into estrogen, becoming lower. So essentially this is a pretty nasty loop. The more weight you gain, the less testosterone you're going to have, which is going to lead to gaining more weight. So obesity, what can I say? Cut that out. Check out the nutrition and training modules and start tackling that. Exposure to endocrine disruptors. Contact with certain chemicals like BPA found in plastics can impact hormone levels. So this is developing research at the moment, but they are finding that there are a lot of endocrine disruptors in the foods that we eat, in the water that we drink. It's going to be an ongoing thing to try and remove these, but these aren't going to be the biggest issue for you. It's not the endocrine disruptors, it's going to be the poor diet, the lack of exercise, the excessive alcohol, high stress, poor sleep, and obesity. Like, you can dial those in. This isn't going to be too much of a concern. This is not going to be the main cause of a testosterone deficiency by any means. So, medications. Opioids. Long-term use of opioid medications can decrease testosterone. They're actually one of the worst things you can do in terms of testosterone. Now, I don't want to cast judgment on anyone who needs these medications for genuine pain. I know what it's like living in pain, and I can only imagine there's people that have it many times worse than I do. But just be aware that if you are using opioids, they will kill your testosterone. It's going to be up to you and your doctor how you choose to approach that. I'm not going to touch that. I'm not going to give any advice on it. I definitely don't recommend stopping cold turkey. Do not do that. This is a conversation to have with your doctor, okay? Glucocorticoids. These are a type of steroid hormone which can lower testosterone when used excessively. So again, same thing. You may need these, you may be prescribed these. This is a conversation to have a talk to your doctor with. Sorry, that sentence made not a lot of sense. This is something to talk to your doctor about, essentially. Antidepressants. Certain antidepressants may affect testosterone levels. Again, talk to your doctor about this. Antipsychotics. Some antipsychotic medications can influence hormone production. Definitely do not come off antipsychotics if you are on them. Go and speak to your doctor. Chemo and radiation therapy. These treatments for cancer can impact testosterone production. Again, don't stop it. Just talk to your doctor. Statins and other cholesterol-lowering drugs. These can sometimes affect testosterone levels. These aren't a huge effector, to be honest. Quite minimal, but again, don't stop. Talk to your doctor. Hormone replacement therapy. Testosterone levels can be affected by other hormone therapies, especially if not properly managed. So, there may be various hormones that you need help with, whether it's thyroid. That's probably the biggest one that's going to play in testosterone levels. This is very individual specific. Again, something to talk to your doctor about, but just keep it in the back of your head that if you are on some other sort of hormone replacement therapy, it is going to, well, probably will have effects on all the other hormone systems in your body. So, natural supplements. What can you actually take to help boost testosterone levels? Vitamin D, often known as the sunshine vitamin. Vitamin D is linked to longer life and testosterone production. Vitamin D is linked to basically being good for damn well everything. It's incredible. If you're deficient, you can get blood tests for this. Pardon me. You can get blood tests for this. Definitely recommend getting it if you can, to sort of figure out where you're at. Do not over supplement with this. Don't think that if you take a heap of it, you're going to have really high testosterone levels. It's not how it works. If you take too much of this, you can mess yourself up pretty badly. So get tested, see if you actually need to supplement it first. D-aspartic acid, an amino acid which may increase luteinizing hormone and in turn could boost testosterone production. This is sold over the counter in a lot of like sports nutrition, like bodybuilding supplement shops, and it does work. It's tried and true. It's been sort of on the market for, I don't know, decades now. So this is one that's worth looking into. Fenugreek, a herb that may help to increase testosterone levels and improve sexual function. This is a little less, there's a little less sort of study done compared to D-aspartic acid, but it is one that you can look into. Ginger, this common household spice, has been shown in some studies to increase testosterone levels and sperm health. I'm a big fan of ginger for a lot of other reasons as well. A lot of them like GI related, like digestive tract. I think ginger is a pretty great supplement all round. So it's a nice little bonus that it boosts testosterone and sperm health too. Zinc, an essential mineral which plays a role in testosterone production. Zinc deficiency has been linked to low testosterone levels. Zinc's a super easy one to supplement as well. You can actually get a zinc and magnesium combo supplement designed to take overnight before bed. Helps relax your muscles with the magnesium, and then the zinc obviously helps with testosterone, among other things. So zinc, definitely worth checking into and supplementing with if you need to. Ashwagandha, a herb traditionally used in Indian Ayurvedic medicine that might help increase testosterone levels, especially in stressed individuals. So the mechanism through that is, as we were talking through just previously, if you have high cortisol levels, it can crush your testosterone. Ashwagandha is essentially going to help your body manage stress better. So it can bring down cortisol, which if that's what's been crushing your testosterone, then obviously that's going to come back up. Tribulus terrestris, a herb that has been used for centuries in herbal medicine. Some studies suggest that it may improve testosterone levels, though evidence is mixed. So just put this one in here because there is a bit of good info out there. There's also some conflicting info out there. Look into it yourself and see what you think. Magnesium, a dietary mineral that may help increase testosterone levels, especially when combined with regular exercise. So magnesium's awesome for a whole heap of stuff. especially with that zinc and magnesium supplement I was talking about just before, ZMA they call it. But yeah, definitely recommend looking into magnesium supplementation. I'm a big fan. I take magnesium every single night before bed. Now, excuse me while I butcher this word. Dehydroepiandrosterone, DHEA, a naturally occurring hormone that the body can convert into testosterone. However, it should be used with caution as it can have side effects. So, in Australia, this is actually a prescription medication. In the States, you can buy it over the counter, but it is not something that you want to take lightly. It can have a lot of downstream effects. It has a fair few effects in the brain. So this is something that you probably want to have a chat with your doctor about before pursuing it. And saw palmetto, often used for prostate health. It might also have an impact on testosterone levels, though research is limited. So yeah, basically, it might help, it might not. There's some evidence to say it does, but there's not a heap of evidence, essentially. So, if you've exhausted your options, you've changed all your lifestyle habits, your behaviors, you've figured out where your nutrient deficiencies are and fix them through supplementation, and you've been back and got more blood tests and you're still deficient in testosterone, then TRT is probably an avenue to go down. TRT stands for testosterone replacement therapy, and we're going to cover the forms of it, monitoring and follow-up, and potential side effects. So, forms of TRT. Injections. Testosterone cypionate or enanthate, typically administered every 1 to 2 weeks. But there's multiple different esters, they are called. So, testosterone being the base hormone, cypionate, enanthate, they are esters. So, what an ester does is controls the rate at which testosterone is released into your body. If you just injected pure testosterone, it would all be released immediately, and then it would all be gone almost as fast. The esters let it hang around in your body a bit longer. It's essentially more of a drip feed rather than just, smashing it all in there at once. So there's multiple different esters. There's some long ones, and by long, I just mean they take longer to release the testosterone into your body. There's also some very short ones. So different doctors are going to have different protocols. So there's topical gels and patches applied daily to skin, allowing testosterone to be absorbed through the skin. Some people have pretty good success with these. I'm a super hairy guy, so I couldn't get them to stick. They don't stick to my skin. Also, probably be true if you have oily skin, whatever. Some people have good success with them, some people really like them. I didn't. Pellets implanted under the skin, slowly releasing testosterone over several months. So these are a somewhat common intervention. The only downside of them is once the pellet is implanted, there's no way to change the dose. So if you're putting a patch on, you can trim the patch down to size. If you're doing an injection, you can change the volume of fluid that you're injecting. With a pellet, once it's in there, it's just doing its thing. So if you start having side effects from TRT, it's very, very hard to manage with a pellet because you can't change the dose. Oral tablets, less common due to potential liver toxicity. So some people do still get prescribed these, some people have some success with them, but because of the liver toxicity, I think most providers try to stay away from them now. So monitoring and follow-up. How do you actually get this dialed in, and how do you make sure that your health is still in a good place, essentially? Regular blood tests to monitor testosterone levels, red blood cell count, and other parameters. So all those blood tests that we covered just before, you want to be getting regular blood tests so you can monitor the changes and see what it's actually doing to your body and adjust as necessary. Adjustment of dosage based on blood test results and symptom management. So this will be as a result of basically the feedback that you're getting from your regular blood tests, but also how you're feeling. You know, if you start crying all the time when you're watching movies, if you start getting like some sensitive nipples, if you have acne breakouts, that sort of thing, maybe your estrogen's running a bit high. There's a lot of other side effects that can come with it, and we'll cover that soon. But basically, you want to adjust the dose until you're getting the maximum beneficial effect with minimal side effects. So, what are the potential side effects? elevated red blood cell count. So testosterone stimulates EPO in the body, which is essentially the catalyst of red blood cell production. So like we were talking about before, if you are anemic, you have less, like a lower red blood cell count. Okay, that means that oxygen's not getting transported around your body in the right way. On the flip side, if you have a high red blood cell count, it means that you can be at a higher risk for blood clots. So this is a super important one to keep an eye on. Acne and skin reactions. So yeah, any hormone interventions can cause acne and skin reactions. And you know, one of the things that I noticed early on, maybe TMI, maybe not, but I got acne all down my back from where I was sitting against my backrest, and I started getting a little bit on my butt as well. So that can obviously open up and, you know, turn into a pressure sore or a bigger issue than it needs to be. So if you do start TRT, keep a close eye on acne and any other sort of skin reactions. Prostate enlargement. So if you still have sensation, like you can tell when you need to pee, all that sort of thing, the first indicator you'll notice with prostate enlargement is that you'll need to pee more often. So you'll just feel the urge more. If you don't feel the sensation, then it's sort of, they call it benign prostate hyperplasia. So it is benign. The only thing is that it can be annoying if you need to pee all the time. But if you don't feel the urge and you're not having to increase the frequency that you're cathing or anything like that, then it's probably not as big of an issue. It's definitely not going to lead to prostate cancer or anything like that. Like, that's been disproven several times over now. Sleep apnea. So what can happen essentially is, as your testosterone levels come up to normal, you may have had low estrogen levels as well, and they will also come up to normal, and your body can retain a little bit more water, and some of that water will get retained in here. And so what that can do is minimize the size of your airway, like not by a lot, just by a little bit, but just make your airway a little bit smaller. And so when you're sleeping, it makes it easier to snore or to stop breathing, like sleep apnea basically. So don't worry, you're not going to die in your sleep, you're not going to suffocate to death in your sleep from testosterone, but it is important to keep an eye out. Like if you start your testosterone supplementation and you know you've got a partner, or you know someone tells you that you're snoring, then that's worth looking into. Also, if you live by yourself and you're waking up and you're feeling not rested, then that's maybe worth doing as well. So that's something to talk to your doctor about. Infertility due to reduced sperm production. So this is almost guaranteed. Reduced sperm production is pretty much guaranteed. Infertility is not. So what happens is, when you introduce an external source of testosterone into your body, those hormones LH and FSH that we were talking about before, they're what's signal your testicles to produce testosterone. So if there is an external source of testosterone coming in, those two chemicals drop off, because they're like, okay, cool, there's enough testosterone here, we don't have to keep telling the balls to make more. These are also the hormones that sort of modulate sperm production. So your sperm production can drop off. It's not permanent. There are ways to counteract it. There are ways to reverse it. Definitely have that discussion with your doctor. Maybe even freezing some sperm might be a fail-safe. But if you start testosterone, you're probably not going to immediately become infertile forever. You will have reduced sperm production, but it's in most cases very, very recoverable. Liver toxicity, specifically with oral formulations. So it shouldn't be a huge concern with injectable. That will basically bypass the liver. It's only the oral formulations that are processed by the liver. So if you're on an oral testosterone, definitely keep an eye on that. If you're on an injectable or a patch, not such a big deal. Still worth getting your liver blood test done though. And, well, that looks like that's it. I know we have covered a lot here, but there's going to be a pinned post down below about testosterone. It's a super big interest of mine, so if you have any questions, just comment down below on the pinned post and we'll have a chat about it. Thank you.